just in summary, if you're an Asian American listening to this, your chance of getting stomach cancer is 2 to 13 times more likely than your non-Hispanic white American friends. And what is the risk factor? A lot of people ask me, what is the risk factor? Like if to develop stomach cancer. Well, you're more likely to develop stomach cancer if you are older than age 40. Older you get, the higher the risk. If men are twice as likely to develop stomach cancer, and Asians are highest risk, and then Hispanics and Blacks and whites. H. pylori infection. If you have an ongoing H. pylori infection, studies have shown it can be up to 8 times the risk of anyone else who has not had an H. pylori infection. And we can talk about mitigating some of the risk by treating H. pylori. If you have it, we know we can treat it, and that will decrease your risk. Smoking and alcohol. So I just learned recently that, the reason alcohol dehydrogenase is the enzyme that breaks down the alcohol. So if you don't have it, you turn flush, you drink a glass of wine and you turn into the color of the red wine. I had a few friends like that. Well, the alcohol dehydrogenase deficiency can contribute to, if you drink alcohol, to gastric cancer. And of course, we've always heard salty food is bad for us. It's bad for our thinking, our memory. Well, it's also really bad if you have a lot of salty foods and smoked food. That increases your risk of stomach cancer. Fruits and vegetables are good for us. As we know, it also is healing in terms of our stomach, and so it decreases our risk. Low socioeconomic status, family history of gastric cancer, immigrate from high incidence nations, and some germline mutations can also increase your risk. These risks are a little bit different from the tumors that occur in the proximal stomach.